Hello, PsycU community, and welcome back. Becky Wong here from the Osaka Field Medical Affairs team, and welcome to today's recording on part 3 of 4 of this series on the 12 step to inclusivity in mental health services. Thank you for joining us. Today's recording is sponsored by Osaka Pharmaceutical Development and Commercialization INC and Lumbeck LLC. I am an employee of Osaka, and our speaker is a paid consultant for Osaka. Materials were developed in collaboration with our feature expert speaker, Dr. April Thames. Dr. Thames is the professor of psychiatry, chief psychologist of the Adult Division in Psychiatry, and associate director of the Medical Psychology Assessment Center at UCLA School of Medicine, and was a past associate professor and clinical neuropsychologist in the Department of Psychology and Psychiatry at the University of Southern California. She has led several projects funded by organizations such as the National Institute of Health, Alzheimer's Association, and Robert Wood Johnson Foundation. Broadly, her work focuses on social determinants of cognitive health with a focus on how racial, ethnic, and socioeconomic disparity impact cognitive and mental health outcomes. Thank you, Dr. Thames, for being here with us. And at this time, I'm going to turn it over to you so that you can walk us through the third series.
Thank you, and hello, PsycU community. In this series, we're going to talk about data collection. And you may be thinking, what does this have to do with cultural competency and responsive services? But hopefully by the end of this series, it will make a lot of sense. We're going to discuss data collection methods that are necessary to gather prior to the patient encounter, during the patient encounter, and after the patient encounter. Most people think of research methodology when the term data collection is used, but there are clinical methods that we can use and develop hypotheses, and we can think about our patients in a very thoughtful way and an empirical way. And that is going to promote ultimately inclusivity and respect for diverse perspectives in the context of mental health care. I have always been really intrigued by ethnographic data. Ethnography is a social research method. That's how it originated. And the idea is that you are learning about people's cultures by observing them in their natural settings. And you're thinking about how to understand their way of life and understand their own cultural lens. Now, as we think about culturally based approaches, we can think about ethnicity, nationality, gender, racial identity, regional origin, occupation, and so on. And in the healthcare field, we might be thinking about a particular pathology such as cancer, heart disease, or diabetes. Now, although you may be thinking, how would I go about observing a patient in their natural setting? This is probably not something that we're able to do, at least in the context of the way mental health care is set up right now. But we can ask questions about, what does the patient do? What do they like to do? What are some of their hobbies, their interests? And it's a way that we can get a glimpse into their natural setting and to really understand where they're coming from. And also, we can observe patients with their families. We have opportunities to do that. And that's really key. And we've talked a lot about the nonverbals in the last series, so I won't get into that. But as we think about the ethnographic framework, this can help with providing a better data collection method, if you will. So with ethnographic data, there are some principles to it. Now, not all of these we're going to be able to follow, but thinking about involving intimate face-to-face interactions, that's a principle. That's one of the principles that I think we need to be mindful of in the patient encounter. So really being warm, greeting, inviting, those nonverbals that we just discussed before is going to help with that intimate face-to-face interaction. And presenting an accurate reflection of the client's perspectives and behaviors. So if a client is telling us something, we want to check with them. So we can say, okay, so I heard you say this. Am I understanding this correctly? I ask my clients this all the time. I want to make sure that we are on the same page because maybe they told me something, but because of my own cultural lens, I may interpret it differently. So I need to check in with them to make sure, is this what you're trying to tell me? Am I getting this right? And also thinking about how are we interpreting their behavior. So for example, if a client tells me I'm not depressed, I am so tired of people telling me that I'm depressed, even if I know that they're actually depressed, I have to think about it from their perspective. What does, quote, being depressed mean to them? I may see it, but the worst thing I can do is to tell them, no, you're depressed. That is not respecting their lens and interpretation. So what I can say is I hear that it seems like you're frustrated that you have been told multiple times that you're depressed. What does that mean to you? You know, and explore with them what is behind that. And those are ways that we can help to really understand their lens by which then to interpret results. Don't be afraid to ask your client questions about their culture and their cultural background and the way that they, their family may view mental illness. I think that when we ask people in a genuine way, they're very responsive. And you can say, I don't know anything about your culture. I've never met anybody. I would love to learn about just what do you like to do? What kind of foods do you eat? Things like that. You can really get a sense from your client, and it shows them that you're invested. So even if you don't know about their culture, you're interested. It's important to also exchange stories. Storytelling is really a great way to share experiences that really go beyond culture, initiating conversation, and it could be very small. It could be as small as like, oh, I was on the freeway today and I saw this really horrible accident or whatever it is. And you may be not talking about an accident. That's probably not the best, but thinking about how can I talk about something very small about my day, tell a story. It doesn't have to be deeply personal because it's not about you as the provider, but you're using it as a tool to help them to open up and maybe tell you a story about how their day is going. And that is all in building the trust and respectful relationship. It's important, and I think we have discussed this many times throughout the series, but to get an understanding around beliefs as it pertains to mental illness. So thinking about how does the client perceive the etiology of the disease, and that can vary across cultures. But once you have a sense of how your client views the etiology or the causality of a disease, it will help you with having insight into the types of treatment that they may be more amenable to adhering to. For example, some people really do not like Western medicine, which makes it very hard. And they want to take more Eastern approaches and think about holistic or natural methods. And it's okay to explore that with your client and to think about, well, how can I provide them a treatment recommendation that might integrate both, or that if I can be open about their views about treatment methods that they prefer, maybe I can integrate what I think might be best for them and engage in that conversation. And there are several questions that you can ask that are available on the slide, just some examples of to get at what they believe is the cause of mental illness and what they tend to think are the best forms of treatment. Now, another piece that is extremely important, but we haven't discussed, is thinking about intersecting cultural identities. Up to this point, we've been saying culture broadly, But in reality, we have a lot of intersecting cultural identities, all of us, and our patients do too. And so, as we think about the overlapping nature, which identity is important in which circumstance, that is important as we go through the treat clients. So, for example, I work with patients who have chronic medical illness, one which is HIV, which is often stigmatized still, even in today's times, unfortunately. And when I talk to patients, I may be dealing with an African American woman who has HIV, but the HIV status may not be relevant in some situations. It may be her racial ethnic identity. Whereas in others, at her job, it may be being a woman. That may be more of the predominant identity in that context. And the illness may be an important part of her identity as she's navigating healthcare. So thinking about sort of which identity is really important to recognize and focus on, and in the context of mental health care, is extremely important for making sure that we understand these various systems of oppression, domination, and discrimination that people may have encountered throughout their lives. So how do we talk about intersecting identities? Well, first of all, it's important to, as we've talked about in the first series, think about our own cultural identity as the provider, but this time it's important to engage in discussion around the client's cultural identity. So what does it mean to them? And working collaboratively to think about treatment issues and obstacles that may get in the way for behavioral health treatment and maintaining recovery. And so we can engage a client by just showing them like a wheel of intersecting identities, which is present on the slide. And you could even show them this and say, look at all of the aspects that can go into one's own cultural identity. So someone who says, I'm a mom, I identify as a mom with young kids, that's important to know because there may be stressors or barriers for her receiving mental health treatment because she needs to take care of her kids. So these are very important things to understand as we move through our relationship with our clients. So in this series, we really try to discuss data collection methods and thinking about observation using principles of ethnography, but not necessarily ethnography methods per se, but using it as a framework to try to understand our client's culture, as well as thinking about intersecting identities. And we all have them. We all have professional identities. We have our personal, social identities, along with all the other types of cultural identities that we've discussed. And working with our clients to bring that to their awareness is really important to do.
Thank you, Dr. Thames. And I encourage the audience, if you haven't listened to part 1 and part 2 of this series, please do so. We hope you enjoyed this recording, and this concludes part 3 of this series. And we would like to invite you to join us for our final series on the 12 steps to inclusivity in mental health services. Thank you so much.